Good evening, everyone, and thank you for joining us for another episode of Advocacy. Tonight, this is going to be a very good. I mean, every night is it's every Thursday. It's a good podcast, but we're definitely going to talk about getting ahead of your the medical any type of medical issues. So we think this would be good because it gives you a knowledge base of a medical crisis with our disability community. As we know, a medical crisis can occur overnight. So, what we're doing is talking about how do you get ahead of your medical crisis. And I will say that for me, I had to learn that Morgan, um, a lot of Morgan's things, of course, I didn't always know about the various medical conditions that she had. Sometimes they will pop up and they will pop up unexpectedly without any warnings, any signs, even something as simple as a cold. It popped up. So what I had to do is try to get ahead of it. Some of the things that I did to get ahead of it for allergy season. So she wouldn't continue to keep sinus infections. I had to continue to give her allergy medicine all year long. Another thing that I did was I kept up her wellness visits. I always kept up her wellness visits because sometimes when they ran blood work, um, out of the blue, something could come up unexpectedly. One of the things that I know of that came up, I learned that Morgan had thrombocytis. For those that don't know, that's when you have low platelet counts.
No.
I took her, yeah, I didn't know that. And it kind of lines up with somebody that has sickle cell.
Mm,
Basically, she's a carrier of thrombocytis. And I learned that
really?
because um, taking her to just, she had a bad cold or what have you.
Is
When
it
I took
painful?
not that I know of. No,
Okay.
it just deals with her platelet counts being really low. And which I didn't know, if your platelet counts are so low, it can cause you to bleed to death.
Bleed out? Absolutely. I
Yeah,
learned that with my mom. Yep.
I did not know that. I
Hmm.
did not know that. So these are some of the things that I did not know. And I will say that when I took her to it was like one of the aftercare, I mean after hours place, they had taken her blood work. Someone, and this is something that I would caution people, someone did not look at that though her blood levels,
Hmm.
because afterwards I had to take her, I think it was like a month or two later, and I took her to the hospital and they read her blood and they was like, did you know she has low platelet counts? And I was like, what is that? And they was like, they told me about it. And I was like, wow. And I said, well, I just took her to one of the after hour places and they did her blood work. They didn't tell me anything. They was like, yeah, you need to call them. When I
Yeah,
called them,
serious.
do you know that her platelet count was low then? They just didn't say anything to
Wow.
me.
Yeah,
So that,
that's serious. When your platelet
yeah,
count is low, it's serious.
yes.
Hmm.
So one thing that Morgan does have is thrombocytis. One time we used to have to keep going every week or every 2 weeks. I forgot the amount of time, but she would have to go to a blood clinic, that hematology clinic. I think it's
Okay.
hematology.
Hmm.
She had to go every week or every 2 weeks because they had to check her platelet count. And there were times that I went, she had a terrible cold, and I was like, oh, it's going to be good. I mean, it's going to be bad. And it was high.
Hmm.
It was never high enough, but it was, high. Other times we went, she was perfectly healthy and it was low. So one time she went to school, and when I came in to bring her in, she had a knot on her head. And he was like, when did that happen? It was like some, Morgan is accident prone.
Hmm.
And he was like, this is when I understood the seriousness of the
Yep.
thrombocytis. He said, Paula, she could bleed to death. And I was
Yep.
like, what do you mean? He said something as small as her hitting her head could
Hmm.
lead to her bleeding to death. And what they did was they took us to where people get the like chemo, and she
Yeah.
had to do a
Gotta get
7-hour drip.
Yep. Yep. She had to get a transfusion, a platelet transfusion.
And
Mm.
that's just what she did. And you know what he said? He said, listen, I know her platelet counts are gonna go up real quickly
Yeah.
when we test them, they're gonna go up. He said, but just imagine they're gonna go back down. And they did.
Yeah.
But he said, I still wanted to do it just to give her a head start. And I want to say that was probably like 7 or 8 years ago. And
Okay.
what happened from that is one day we went in there and her platelet counts were they were just normal. I mean, he said that she's going to always have that condition, but if she married somebody with thrombocytis and they had a baby, the child would have full blown thrombocytis, just like
Wow.
sickle
So
cell.
it's definitely similar to sickle cell.
It is. It is. Now, I
Wow.
don't know what comes along with that, but the
Mhm.
fact that it's a blood disorder definitely speaks to something, something with the blood. But I will say this, getting ahead of that was, kind of becoming familiar at the time. It's been some years, guys. But what I did was I went and did the research. I worked with the doctors to kind of understand things. When he told me she could bleed to death, I was
Yeah.
much more cautious about things that she did because Morgan was very accident prone. I
Mhm.
was very cautious about where she went, what she did. Sometimes when she get mad, she would have a helmet on. I watched
Yeah.
her hitting her head. Things like that for me, it was like, that's some of the things that I would say I tried to get ahead of, just understanding the process. And throughout that process, they could have put her on medication.
Yeah.
What I did was, I worked with the doctors to kind of I said, let's have a timeline as to when we would want to put her on medication because I just didn't want her going on another medication unless I really felt like she had to.
Yeah.
And so I got a great doctor and we worked together until one day her platelet counts came up and they never went back down.
That's good. And for
Yeah.
those that may not know why platelets are so important, and I learned this with my mom, platelets is what clots the blood
Yes.
so that you won't bleed out. The way they explained it, if my mom was to hit her leg,
Yeah.
she could have bled out because it would have been internal and we not know it. So
Mhm.
it is serious when your platelet count is low.
And another thing, Bunny, whenever we came in the office, and I do this to this day, um, they would pull up Morgan's shirt and check her back for any like big blotchy spot.
Red spots and stuff.
Yeah.
Yep,
Yeah,
yep.
it was
That's an
so that he
indication.
yeah, I didn't I'm telling you, it was
Mhm.
like they kind of stripped her and we would check her all over. And I will say to this day, I do that now.
Yeah,
That's the way again that I get ahead of things because I knew that I was like, okay, if I see like a new spot on her, I'd be like, yeah, something's not right. So I
yeah,
that's one way that I stay ahead of one of a condition that just came out of the blue. And like I said with Morgan, things came out of the blue. It's kind of slowed down a lot, thank
yeah,
God, but they come out of the blue. And I think that's part of their development when they're developing, different things are developing along with them.
yeah. I with Grayson, definitely talking to the doctor and making sure that we go to a doctor office that they have a group of doctors, and
Mhm.
whoever's on call that day is who you'll see. So I just make sure that they all know who Grayson is and if there's any concerns that I have so that they are aware. I don't just leave it for them to check his files. I let
Mhm.
them know. I make sure that any medication that he's getting that it's something that he can tolerate. So that's one way I get ahead of when he's sick. I let them know he only tolerates clear medicines. It's got to be something clear like that amoxicillin, things like that. It doesn't work for Grayson. It's
Now,
thick.
what does the color do for him? I've heard people say that, Bunny.
I don't know. He to take an antibiotic, it has to be clear. He
Okay.
doesn't do any grape color medicines. He won't do those. So just knowing the medications and making sure if there's any emergencies that people understand what to give your child. And I make sure that we all know these are the medicines that Grayson like. his prescription over the counter. We try to really have the same at all households. Another thing with Grayson being nonverbal, having a medical bracelet to
I like that.
identify he's autistic, he's nonverbal, and possibly contact information. That's really good and helpful to prevent him from eloping, and he's not able to tell a person who he is. So those things, and one thing I know we don't have, talking about preventions, is an escape. Grayson he's a big boy now. If anything happened in the home, having a way of escape, like I don't know, what do you call those? An escape safety plan, something like that.
Hmm.
I need to do that. That's important as well. Having a safety plan in the home. If anything happens and Grayson is here, what do we do? So that's something that I'm gonna have to put on my list to think
I
about.
never even thought about that, but you're
Yeah,
right. Because you think,
yeah.
I think when I think about an escape plan, I'm thinking about if you got a mansion, but it's, but
I
it's,
didn't know what window can I jump out of. How
Mhm.
Grayson gonna get out the window? I just thought about that. Like if anything happened in the home, we need to really know how can we all get out, especially if we have someone with special needs that may not hear us yelling or not moving fast enough to get dressed and let's move. So that's another thing that having an emergency plan.
Mhm.
Um, yeah, making sure that all households, wherever, at the school, everywhere, that they understand what to do
Mhm.
in cases of medical emergencies. I think we should all have some sort of plan, whether that
Mhm.
plan is written out, and that's what we don't have. I don't have a written out plan, like medications that he can tolerate, foods that he can tolerate. I think it's really good to have something written down, because Grayson, he will not, he will, that's
Yeah.
how he walk around, and he'll run.
Really?
Yep,
And
he'll
see, it's
run.
like with Morgan, I know a
Mhm.
lot of the times when we go places for medicine, they want to give her liquid. And I'm like, no,
She
liquid
does
is,
better what with pills.
yes. You can
Okay,
hide it in applesauce or pudding and she swallows it whole. I don't
that's
care how
good.
big. Yeah. And I prefer that because it was a fight to get her to do liquid. And some
Hmm.
doctors would automatically give her liquid. And some of the stuff, like I said, this is part of going back to really under having people to understand that God, I mean that your child,
Yeah,
and so a
absolutely.
lot of the times, even when it comes to medication, some people would almost be like, listen, they need this, that, and amoxicillin did not work for my kids. It
No,
didn't. So
Grayson
that was the
won't eat.
first thing that they wanted
Yeah.
to give is amoxicillin. And I'm like, Jeremy's
Hmm.
allergic to it. And I do believe Morgan has some sort of allergy to it because whenever they've given it to her, it doesn't work. If they give her the
Yeah.
augmented version, she has diarrhea. I mean, she's had diarrhea to the point it just ripped her skin off her behind. They had to make a paste for her.
Mm.
So, yeah, so I do believe that some of that definitely has to do with her being somewhat allergic to it.
Yeah.
Um, yeah.
And it goes back to knowing your child and
Mhm.
making sure that caregivers, doctors, everybody know that just because one medicine or one way works for one kiddo, it's not a one fits all type situation. So just making sure that you're providing everything Morgan needs, we're providing everything Grayson needs, and everything will be so much better when everything is laid out and understood across the board. Even at school, you
Yes.
have to, yeah, we've got to make sure. And I think that people forget that you need to talk to your teachers about medications,
Hmm.
not just the doctors, anybody that's, visiting with the child, or, babysitting or whatever. Everybody needs to know.
And
Mhm.
I do know that one thing that I did not realize was so um a condition that Morgan had is she has seizures. She used to have them so much when she was younger.
That's
She
really
won't.
scary.
It is, but
Yeah.
it's funny because I think I guess I kind of took for granted that it was like something, normal for us. That it became so abnormal with everybody else. Of course, when it was around my family, everybody kind of knew. But I will say initially when she first had her seizure, I think she was going on 2. And Jeremy walked past and saw her sitting in the floor and she was like blue. I lost my mind. I just
Oh
went
no.
crazy. And it was so scary because she was having them at will. It was and for me, when you think about any type of condition, I look at something for me, it's like something has prompted that. It gotta something is
Hmm.
causing this. And when you can't figure out the cause of something and you just like dumbfounded, it's like it just takes me for a loop because for me, it's like it's radical number one, it's random,
Yeah.
and
Yep.
I mean, it was so scary that me and Jeremy would ride, just keep looking at like I'm driving and I'm just constantly looking back.
Looking.
And I was I lived in so much fear because I just when she went, they were like, she could have a seizure and never recover. I mean, when I say I was so fearful,
And there
I
were
was
no signs.
there were no it was nothing in my mind that brought it on. Now
Okay.
what I did over the years, I continued to like watch her. I kept
Hmm.
notes, and one thing that I found is that it was a gluten every time she ate gluten.
Oh wow.
And again, I didn't know really much about gluten. I was talking to somebody and they said something about gluten. And I was like, tell me more about it. And when they said it and they was talking about like it's associated with seizures, I started doing my research. And
Wow.
and then she was going to La Petite at the time. I had to send her breakfast. It was just so hard because she at the time Morgan doesn't chew well.
Hmm.
So I was sending her breakfast. It wasn't much that she could eat that didn't have gluten in it. So I started giving her oatmeal. I'm take that back. I'm sorry. She couldn't eat wheat. So the
Okay.
whole gluten thing, it was not that she couldn't eat gluten, she couldn't eat wheat. So from that, anytime she digested wheat, she had seizures. That was my test. I was like, okay, I got to give her wheat. Gave her wheat, she would have seizures for 3 days.
That is a blessing that you were able to identify
Mhm.
something that was causing the seizure so that you can stop it.
Yeah, she would have seizures 3 days. And what that showed me is that it took 3 days to go through her digestive system and come out of her.
Mm.
hmm And I kept telling the doctor because they kept increasing her seizure medicine and increasing. I said, I think she has a wheat disorder. He was like, that doesn't make sense. I said, well, what I'm seeing is when she has wheat,
A
she
lot of
has.
stuff don't make sense.
But you know
They
what I
don't know
did?
how the kids getting autism. That doesn't make sense,
It
but it's
doesn't.
happening.
Exactly. So what I did was I was like, do you know at that time you could get a bag of food, maybe 20 items from Whole Foods for $100. That's how because everybody didn't have that. I used to have to go in and look at the labels and I
Yeah.
would have to send her breakfast, her lunch, her snack. And it was limited as far as what I could get her because they didn't have the variety of food like they have today. And I was like, good. I don't want her to have a wheat disorder. You know how
Right.
expensive that is. So I listened to him and I let them give her. Somebody had a birthday party at the school, and I let them give her cupcakes. And they were saying she had seizures for 3 days. So I
Oh
would
my
get the
goodness.
calls, guys. I lived in fear. I walked around with my phone on me all day long. If I left it on my desk or anything, I was in a panic.
Yeah.
hmm Because when I would get
Mm.
back to my desk at times, they would have it where the school done called me 3, 4 times. So
Wow.
those are things when it comes to a medical crisis too. For me, I consider that a family crisis.
Yeah.
Because it was something that had me and Jeremy living in fear. And what I told Jeremy was, I was like, Jeremy, we can't live like this. If God's
Yeah.
gonna take her, He's gonna take her. It's nothing we can do. But I will say that's easier said than done.
Yeah. Yeah.
Uh-huh.
Definitely. I
Yeah.
I Grayson is still pretty young, and I'm praying that he doesn't go through any more medical
Yeah. It's
situations
hard.
like autism. Even the school now is testing him on his AA device, or is it ACC? Sort of assist AA device, AAC device, his communication device.
Okay. Okay.
So that's really important as well with these medical emergencies and trying to, be preventive in that area, making sure that those that are, taking care of your child, that they understand how to use those devices, understand to allow grace and, time, or the child time to use it. It's a lot to factor in when your child have a disability, period. And then you've got a list of medications, and you've got a list of devices and other things. It's a lot. So I would caution everybody, including myself, to just write out everything that involves Grace and his day to day. That way, anything happened to us, somebody needed to step in, we've got some type of medical plan, emergency plan together
Hmm.
that they can see, because medical emergencies, I'm not one to panic. That would be my husband.
I'm a panicker.
I'm not. I don't think that I panic. I jump in a different body. I'm in a different mindset at that point.
Hmm.
So I thinking of this is a good topic to talk about, Paula, because it prepares us. I am
Yeah.
now thinking about ways, if something was to happen, if you know, what can we do in
Yeah.
these cases of emergencies? How
Yeah.
can we better plan? So this is a perfect conversation to have to prepare me,
Me too, buddy.
because I never really thought about preventing, planning medical emergencies. We know, there are some emergencies, but like stepping in ahead of that and planning it for someone with a disability, I
How
just,
do you do it?
yeah,
Because
yeah,
you're living for the day to day at this point. I think the day to
absolutely.
day can be overwhelming.
Yep.
You're right.
So
I
I just
think even,
I think we need to stay calm, make sure that we have
yeah,
all the necessary documents, paperwork, and we're able to communicate to the doctors on what the issue is. That's number one, making
yeah,
sure that everyone involved understands and we show up, because at that point you need a village. You need a village for support for the kiddo and support for you
yeah,
to
yes.
help keep you together. This is a really good topic, because
Now I really,
the weekend, I'm going to get some sort of, I'm going to find a template somewhere, medications, contacts, likes, dislikes, what they need. I'm going to find some type of template, because I think it's important that we all have something like that.
but you know what, Bunny? I'm serious when you're saying this. I really, I agree with you. I really never thought
Yeah.
to even look at it from that standpoint, because I think sometimes we take for granted that it's so easy for us. But what if we weren't
What
there?
Because yours could be, if Morgan does this, here's a remedy. If Morgan doesn't want to eat, okay, she may eat an hour later or something. I don't know, because you know her best. So if
Yes.
anybody, like the person that cares for her when you're gone, it may be something that you could tell her to prepare her.
Nikisha gave a good thing too. Video clips of how to use devices or put on external supports are helpful for individuals who may have to step in case of an emergency.
Yeah, that's how bad. Yeah, yeah.
Yes, I
Some
definitely.
visuals. Yeah,
Mhm.
video clips, visual pictures.
Yes,
Yeah, I think it's all important that we lay out, almost have a manual.
it's
Morgan's
the truth.
manual, Grayson's manual,
It's
CJ's
the truth.
manual.
Yeah,
Yeah.
and I do think that I think it's kind of, and I know for me, I don't know about anybody else, but the places that that are familiar with Morgan, like her school. I mean, I can honestly say like her school um is somewhere that I feel like they know Morgan to the utmost. But
Yeah.
for most people that don't know, she graduates next year. So it's like, even when they say, okay, would you put her somewhere else? That's a all like a process to go through. I mean,
Yeah.
Morgan's good days, her bad days, her not want to be bothered. I mean, it's just like something for real that you definitely it's that adjustment process is so terrible.
Yeah,
I'm
because
not even kidding. When
you almost gotta move now from Morgan being in the school setting to now Morgan being in a different setting
yeah,
with a different set of rules and all of that.
yeah.
Yeah.
And on an adult level, I mean, it's something that I'm not even gonna lie, guys. When Morgan was younger, I always thought about, well, when Jeremy gets this age, Morgan will be this age. And I always am
Yeah.
never, if you would have asked me how did I think it would look, I didn't know. I was like, I'm gonna take one day at a time.
One
I
day at a
can't,
time.
yeah, I can't think that far ahead. But in some cases, it's good for planning purposes. But you just because things change all the time with our special needs community, you just don't know how to properly plan because you don't know what it's going to look like.
Yeah, yeah,
Hmm.
we definitely don't. Even talking about planning, we can even talk about maybe not considered a medical situation, but in the planning of making sure that we properly identify who our children are with disabilities, we could definitely add that all behaviors aren't bad behaviors. Some behaviors are because of X, Y, and Z. It may be
Hmm.
their way of communicating a need. So
Hmm.
even, talking to someone about, if Grayson starts to do this, he could be trying to communicate or express himself. So it's a lot to think about trying to do a manual about who Grayson is or who
Hmm.
Morgan is, but I think it's definitely important that we have something like that where it's a book,
I
Morgan's
agree.
book.
It would be a book
It
because
would be
it's
a
so
book.
much to them.
It would be a
Yeah.
book explaining medications, explaining foods, explaining behaviors, whether
Sleeping
they
habits.
not. Yep.
Sleeping
Explaining
habits. Yeah.
everything, sleeping habits, why they don't sleep.
Yes. Yes. And I will say that even for some people to like with Morgan overnight, like Morgan, if Morgan is in an unfamiliar place, if she's in a familiar place, it may be terrible, but oh my God, it's going to be awful if she's in an unfamiliar place. So some people you may wake up to her crying and you're thinking there's something wrong when in fact she's trying to express the fact that
Yeah.
she is in an unfamiliar setting and she doesn't, she's upset about it. So you're right. I
Yep.
think this is I didn't let Morgan and Jeremy stay out a lot when they were younger. And it's like that now because
Yeah.
for me, it's like it's definitely Morgan loves home and
Mhm.
it would be something that would send her into a crisis mode. Like she
Yeah.
may stay up all night crying.
Yeah,
Hmm.
unfamiliar places. We used to go places, and Grayson would not use the bathroom. He wouldn't
Yeah.
have a
Back
bowel
home.
movement.
Yeah.
He would wait till he got back home because he didn't feel safe. It was unfamiliar, and we had gotten to the point he would go into hotels and go into the closet, and we would just create a calming space. I'll
Mhm.
go in, clean the closet, put a blanket down, and that would be his space. Now, thank God, he is using the bathroom. He's using the toilet, and that has just been amazing how much he has developed in that area. But when he was a little younger, he definitely would not, he did not feel safe. It was going into a strange place. So
Mhm.
we would always try to give him something, a gummy, a melatonin. Is it melatonin? Yeah, a gummy to calm him, those calming gummies to try to calm him, but then we had to realize he doesn't feel safe. So we had
Mhm.
to create Wherever we went, we had to create some type of little nook under a table, put some blankets down, and let him have his space. So even situations like that is important. I remember when Grayson was a little younger, and I had one of the mothers from the church was at my house, and she was babysitting. And
Um,
Grayson used to stay behind the couch. We would pull the couch from the wall, and we had a space and a ton of blankets, his toys, and that was his safe space. He stayed behind the couch on the floor. He just played with all his toys. He would go to sleep back there. We made it real comfortable. And she called me at work, and she said, I can't find Grayson. She said, I've looked all over the house. Grayson might have been, I don't know, 3 years old. She said, I can't find Grayson. I feel so bad. Do you know where he is? I said, check behind the couch. He's behind the
I
couch.
love it.
So, it's stuff like that
Hmm.
we've got to let people know. You're coming in, you're going to come and sit with Grayson. If you can't find him, he may be behind the couch. He may be in the toy box. So it's creating a book of
Hmm.
our children.
And I like what Keisha said, a digital physical. I'm gonna definitely look for
Yeah.
that for Morgan, because for me too, with her now, going into a different age group, I'm finding different things that, could definitely, like if someone had to watch her or something
Yeah.
happen with us, that would definitely be a help. And I'm not gonna lie, I mean, even some of the things that's going on with her, I take notes for myself because
Yeah. Because
they're
she's changing.
constantly changing.
Yeah.
Yeah.
She's evolving. She's now going from being, a teenager to being now she's literally a woman.
She is. She is. She
Yeah.
is. And I
So
know
that
one
is, yeah.
another thing that I had to prepare for, which was one of the hardest things, is her foot surgery.
Oh yeah.
Um, Morgan's tendon, it was to lengthen her tendon in her left leg. And from my understanding, that was a very, very painful surgery for her.
Mm,
And it was very painful for me with the recovery. This was a planning thing because they kept doing Botox shots and she would walk flat. And some people would say, well, Paula, what's the big deal of her walking on her toes? What they didn't understand is she would get calluses on the bottom of her feet so bad
yeah.
because she would walk on her tippy toes to where she was so unstable.
Hmm.
Um, and when they would do the Botox shots, it would relax her legs and she would be flat again, where she could just walk flat. And as she went through a growth spur, it would happen again. And they would put her in, do Botox shot, and it would cast her legs. She would go flat again, but it kept happening. Of
Hmm.
course, because she kept growing. So what they did, they sat me down and we planned this. Because once, and I don't, a lot of women don't know this. I didn't know it, but once you come on your cycle, for the most part, your growing is over. And so they said, well, Paula, she's going. See,
Wait a minute. Why am I still growing out this way? I'm growing out.
Bunny, listen, I can't answer that now. I can answer that. That's the problem. You ain't
I
growing
need to
up
grow
no more.
up. I've been
Yeah.
growing this way.
Nah, it's not
I
gonna
need that
happen.
to stop. I need it to stop.
And I did you know that, Bunny?
I did not.
Yes. Hmm. So the doctor said that this is the time to do it. They said, they normally wait until they come on their cycle for women and they stop growing. So they was like, she's not gonna have any more growth spurts. So instead of us having to repeat this surgery, we wanted to wait until her growing came to an end. And that
Wow.
surgery, I mean, y'all, that was a planning thing, but it was planned, but it was definitely a lot of stuff that went on with that surgery was unexpected. um it was just so unexpected. The recovery period was the hardest.
And then
um
think about the pain. How did she express pain, or how did she change her face, different ways you moved her so that it indicated she was in pain? How did you know?
she pulled her hair out
Okay,
and she would not sleep. I mean, when
stress
I
on
tell you
that.
they gave her a sleeping cocktail, they
Mhm.
gave her melatonin, they gave her oxycodone, and they gave her, did they give her, I think it was one more thing. I don't know if it was a muscle relaxer, but they gave her a cocktail and she still did not sleep. When I tell y'all, She had to recover for 3 months. Um,
Mm.
that was a 3 month. It happened in April of 2019, and she could not get up off of her feet until June. Y'all, she cried all the time. She would just, it was like she was going through a depressive state. She would just lay in a bed. And part of it, we came home and they didn't have any. This is the stuff that just kind of got me just mad about the insurance, because they sent us home and with the understanding that she could not go up the steps. This is a child that's used to roaming the house, going where she wants
Yeah.
to go. Her bedroom is upstairs. Everything was upstairs. So I'm like, okay, so you want me to keep her off the steps? I'm gonna say this: when she had her surgery, the next day, I was sleeping in the chair. We were in the hospital. When I woke up, she was standing on the side. She was sitting on the side of the bed on her foot.
Wow.
So, and they had it where, and I would try to tell them, you can't even having a bed with the guardrails up. That's nothing to her. It's a challenge.
Mm-hmm.
So what they had to end up doing is having us to go to a rehab. We did that. It was depressing. It
Oh
was.
my goodness.
It was. I mean, when I got there, it was. Y'all, she wouldn't sleep. They had her in it. Then they tried to put her in a bed that was like a little the zipping in beds.
Oh yeah. Mm-hmm. So she
She
won't get out.
she stayed up all night crying. When I woke up, not only was she crying, this is another way she was able to express herself. She just kept having bowel
Yeah.
movements all over the place. She was just, it was on her
Yeah.
chest. I mean, it was that night I did not sleep. And I will say, I wrote a letter about the team that was at, it was hospital for sick children. I wrote a letter for the one of the team members. When I tell you, this man was the nicest nurse ever. When I came in, he was trying to explain everything. It was so hard for me because it was hard for her. But
Yeah.
that next day, and that was the daytime staff. When we came in, said we got there like 4. They would get ready transition, but he kind of got us acclimated. And then he left. The night staff was just as cold and mean as they wanted to be. So I was in there by myself trying to calm her. They gave no help because I was there. They was like, we ain't doing nothing. When
Yeah.
he came in the next day, he was like, well, how did things go? I said, we watched the sun go down and we watched it come back up. He said, you didn't get any sleep. I was up all night. So the next day, what he did, he told the nurses, because your mom is there, they be like, yeah, we're not gonna help. He told them, come get Morgan. They got her out and had her at the nurses station. They was walking her around the nurses station. Do you know he put a sign at that door? Don't nobody go in this room. I slept,
Wow.
man. When I say I slept for like almost a whole day. When I woke up, and it didn't matter. He was like, everybody leave her alone.
That's good.
It was. And we stayed there for like a month. By the time we came home, it was like it was a recovery. We got through it. It just wasn't easy, but that was a
Yeah.
medical crisis for me that
Yes.
we planned for, but we
Mm-hmm.
definitely in planning
You didn't
the
plan for the recovery and how that was gonna look. Yeah.
and I will say this, a lot of it I was a little disheartened because we did a lot of planning beforehand. Like they had me to come up to children's, they had all of the departments to meet with me, and what they told me is we met beforehand so I could tell them all of her needs and we could prepare for this.
Mhm.
And when it was time for her to have a surgery and it was time for us to go, nothing was planned. It was a waste of time. It
Wow.
was a waste of time. So all of those months coming up there talking to the nurse practitioner, talking
It
to
was
the
a waste
physical
of your
therapist, it was nothing. When I say it was like it was a one man job, and that was me.
time. Yeah.
I
Yeah.
was, yeah, that was a 3 month ordeal that we got through. And it was like you in jail. You put the X's on a what's the name every day. I was just like, okay, tonight she ain't sleep, but tonight I promise she gonna sleep. And I would give her a bath, because you couldn't bathe her. So I would, and she loved baths. So
Yeah.
all of that was things that was stripped away from her, and she didn't
Mhm.
understand. So I had,
Wow. That is it reminds me you say, a lot of her comfort items, comfort zone was taken away from her, it makes me think, when we go out of town or we do anything, I always pack sensory items. Even if we go into the doctor, I just make sure that there's something in there that Grayson likes that'll keep his attention. And mostly it's the iPad. But even in the planning for crises and emergencies, have a little to go bag,
Mhm. That's a
with
good
all
idea.
their preferred items in there, some cars, some fidgets, things like that, that can help relax them, because not only going to emergency rooms, hospitals, it's
Yeah.
a big place. It's bright.
Yes.
It's a lot of people. It's loud. It's people constantly going. It bothers. My anxiety is high going into
Yeah.
certain situations, so I can just imagine how they feel. So even in situations like that, don't forget, if they need headphones, grab those headphones. But I just try to think of everything in these emergency situations. What would Grayson need? What is this situation going to be once I get there? How long are we going to be there? Try to find those good, preferred foods, toys, everything.
Hmm.
Yeah, we need to get a backpack and leave it on the side.
Well, I was gonna say that.
Emergency backpack.
But you know what I was thinking, Bunny, when you were saying that it's like when a woman is pregnant and you keep a
Yeah,
bag in your
get
back.
that bag. Yep.
Yeah, I think that's a great idea. I do.
Yeah.
Now I know me and hubby keeps a bag with all of like some extra clothes for her and different things like that. But
Yeah.
you're right. I never thought about like an emergency. It's almost like an emergency sack for Morgan.
Yep. Yep.
A backpack.
If you gotta get up and go really quickly, what are some items that's gonna keep her calm and that she's gonna love? The good foods, non-perishable foods that she may like. Yeah, I'm gonna get a backpack.
I am too,
Keep it.
and I'm definitely going to get one to keep in my trunk. And I'm not even
Yeah.
gonna lie, Morgan owns the car. Everything that back seat is hers.
Yeah.
But when you think about if you have to get out quickly, if there's something you have to get to quickly, what will you do? I think that's an
Yeah.
excellent idea, Bunny, to have a backpack in the back. You should have like those comfortable clothes, them
Yep.
special shoes that she like, everything.
And
And
a
I know for
copy
us,
of
we
a
do
copy
keep
of the
blankets.
insurance card.
Yes.
Keep a copy of the insurance card inside the bag so that you won't have to, try to find that as well. Mhm.
And I know with Morgan, Morgan likes blankets. She loves soft blankets. She got, oh
Mhm.
my God, y'all, she got so many.
Yeah.
Like the marshmallow little things. But I
Mhm.
normally keep those, like sometimes I'll put them in the chair for even when she leave out in the morning to give
Yeah.
her pick of what she wants as a
Yep.
comfort toy.
Yeah. Yep.
Um, yeah, but I definitely think these are good ideas because when
Mhm.
you're going through, just think about this. When a crisis comes up, medical, any type of crisis, it's traumatic for us,
Yes.
especially most times it's unexpected.
And we're not
So
really fully thinking.
yeah. So
Mhm.
if it's devastating and traumatic for us, can you imagine what it's going to be for our special needs community and those that for those that can express themselves? I think even for the ones that can express themselves, they may not have a full understanding of what's
Mhm.
going on. It's
Yep.
like it's happening by the minute.
Yeah. Yeah. And it leads me to think about when we had Travis on and he was talking about the when there's someone that's having a medical emergency and they need the right police officer to come out. I forget what they're called,
Yeah.
interventionist, something like that.
Uh-huh.
It's pretty much, it may be the same if we're calling and we having a medical emergency. If we could just tell dispatch, listen, my grandson is autistic. Please inform EMT when they get here. He's autistic. Approach with caution or something. I'm wondering if that's something that we can do if they have that with the police department and Travis, provide that training. I wonder if EMTs get that type of training to be
Yeah.
able to work or help autistic individuals, or not just autistic, but those just with a disability for their awareness.
That's a good point. I mean, and because when you think about it, all the various ways, the places that they would have to go and things that they would have to do. And I think about even Morgan's doctor, and I think we talked about that before, her pediatrician, they're like they're like a center for Morgan. Like she can come in there and do, she walks up and down the hall. It's like these types of things have to
Yeah.
be like accommodating for her.
Hmm.
So I guess it's too, you're right. I guess, are these people prepared for some? Can you give them a heads up? If you give
Right.
them a heads up, like what will they do as far as interacting with your special needs individual? Because I know for Morgan, she didn't want anybody touching her. She
Right.
does.
Yeah. Yeah.
Mm-mm. She won't give you any attention. And then, with her not feeling comfortable with you asking how, like the doctor is asking her how she feel, even with her speech device, she's not going to really interact with that person.
Yeah. Yeah.
So those are things as well, just having that speech device, having that way of for your child to be able to communicate, or your adult to be able to properly communicate. And then how do you deal with the comfort? Like having them to, as you get older,
Yeah.
when they're at an age that they don't have to have you in the room. And, I know for Morgan now, everybody is, which they're supposed to do, is I don't care when they come at me, they're like, "Where's your guardian paper? Where's your stuff?" Because,
Really?
oh yes, yes, uh-huh.
So if
Hmm.
you did not have your papers on you, would they have you to leave the room?
I don't know. I don't think that they will treat her because she would have to sign for herself.
Yeah.
And because she can't properly represent herself, they're like, you need to have your guardian papers. So what I've done is I keep them on my phone. I have a picture of it on my phone.
Okay.
Um, and even sometimes when I've gone to the same like aftercare places and different
Yeah.
things for, they'll ask for it. Like even if I call to speak on her behalf, I mean, it has been terrible even for me to call and speak on her behalf with the state. um, they
Wow.
Yeah, it's funny because there are some people that really ask, and there are others that don't say anything. But
Hmm.
for me, I try to make sure that those papers are on file everywhere I
Yeah.
go. But again, it's a good thing that when you're familiar with certain people, that you don't, they know me and they're like her doctors and everything. They be
Yeah.
like, "Yeah, we know you. Who's gonna take off work to just come and bring a child to
Right.
work?" But
Right.
yeah, but I think from a legal standpoint,
Okay.
if something was to happen, they want to make sure that you have a legal obligation to speak on her behalf. If you don't, then they will stop talking to you.
Wow, that is something. Another thing I was thinking about, talking about preventing, or being prepared for medical crisis is, um, oh, I just lost my train of thought.
Girl, that happens to us
I know
all.
we talked about staying calm. We gotta stay calm, but I just forgot
I
what I was
say for
gonna say.
me, I think all of this is part of being proactive. Like even her guardianship papers, I
Mhm.
was like
Yeah.
on top of that because when you
Yep.
think about that, if your child is going to the doctor, and like I said, I know when Morgan first turned 18, that's
Hmm.
if you're going to unfamiliar places. Don't just assume that these people, because they see a special needs individual and they may not be able to talk or make decisions for themselves,
Right.
don't think that they're just going to assume that you can do that. They will question that. They
Yeah.
will.
Yeah.
And if you don't have that proper paperwork, they're not going to allow you to make any decisions on their behalf. And you think about it, there could be something really critical, like say your child is out of it, and there's something in the ER that needs to happen surgery wise. If
Yeah.
you do not have those papers, especially with that type of stuff, that the hospital's not going to be liable. So I would say, even from a legal standpoint, as your child is getting to the point of transitioning over to adult services, and you know that you have to be listed as a guardian or whatever action you're going to take, partial guardianship, whatever that is, you have to have all of your legal documents in place, even as far as a bank account. I mean, and I know we're talking about a crisis, but even
Yeah.
when you're talking about paying bills for them, or you're talking about, yeah, all anything dealing with your child at the age of 18, you should be in a place where you know what it takes to step in that role, if that's something that you're going to have to do. Now for me, I had
Yeah.
full guardianship of Morgan, because Morgan cognitively will not
Yeah.
be able to make her decisions. There are some that have partial guardianship. I think that would be a great topic for us to talk about one time is,
I just was about to say that.
yeah,
Yup. That's a good
mhm,
topic to discuss. And I think my mind was trying to talk about knowing the signs when we're talking about medical emergencies, like you talked about Morgan having seizures. If if you recognize the way her face might have changed
mhm,
prior to that, it's those are some of the things that we want to also relate to those caregivers, or even include in paperwork going to school.
mhm,
If Grayson starts staring out, it could be,
yes,
just recognizing the signs of distress, or if there is a medical emergency or medical crisis. Um, those are very important to know the signs. Just like um, they have service animals that
mhm,
can smell if a
mhm,
person is going to have a seizure. It's
yes,
amazing how they train these service animals,
yeah,
but they can definitely smell. It must be some type of chemical imbalance, and an animal can smell that and can go into, I guess, protection mode to help that individual. So, yeah, knowing if there's any signs, identifying that, any signs of distress, just making sure that we communicate that out to everybody, so that if your child or your special needs adult is in the care of someone else, that they are fully aware of how to treat your child in these cases, and even how to identify discomfort, distress, and all of that.
I
Hmm.
agree. And I also would stress that don't downplay anything, because I know for
Absolutely.
me, yeah, sometimes if I know with Morgan, and I think we started out saying how sometimes these things could hit and they just go from 1 to 10. Hers is
Hmm.
always like that. She would sneeze in the morning, and I already told Jeremy, prepare, we're going to urgent care tonight, because when she was younger, she kept sinus infections. And some people, when I would go, they would be like, well, we're just going to let this run its course. I said, there's no such thing
No,
as run its course.
no.
Yeah,
Yeah.
it's running its course. So tomorrow
Hmm.
she's gonna wake up with full blown pneumonia. She used to keep pneumonia. I would say, make sure that you are totally familiar with, like you say, Bunny, the signs, the
Yep.
prevention. Make sure you're knowledgeable about everything that's going on with your child, because um I just had to go to her neurologist, and because Morgan transitioned over to adult services. And I had to sit and I felt, they said I'm so fluent in her, but I was, I had to go back to when she was first born and just kind of go over all the things that, when they ask you the questions, it's easy
Yeah.
to forget things. And somebody was telling me about I should keep a journal. I've never done that, because I'm not even gonna lie to, I just didn't have the time. I was so
Yeah.
busy raising my kids. But I would say too, as a parent, I think it's really good to keep a journal, so that you can know when these conditions pop up.
Yeah.
And a lot of the time, it explains our kids. If your child has a rare genetic disorder, they're really trying to know and understand these individuals as much as
Yep.
possible. So I will say, for me, I wish that I had kept more of a journal to know when she started crawling, to know when she
Yeah.
started walking. I have a ballpark figure, but I
Mhm.
think all of these things play a major role in understanding your child and knowing, how to help other people understand.
Yep. Yep. That
Mhm,
is a good point, Paula, because even in that, even in keeping a journal, if there was any medical crisis, any sicknesses,
mhm,
you can also document what helped, what
mhm,
relieved pain, what what she can use for, to relieve her of, these sicknesses. Grayson, when he got a cold, Grayson was out of school for 10 days.
Wow.
Yeah, Grayson, when he would get a cold, it just was horrible.
That's
It
horrible.
was the nose, the coughing, the chest, the shortness of breath. It was horrible, and he stayed sick a lot. We braced ourselves when it
Yeah.
was like October, November, December. We braced ourselves because those were the months that Grayson was out of school 2 weeks at a time each month. At
Mm.
one point, he was out of school. Oh my goodness, it was like 64 days or something for one quarter. He was
Wow.
out a lot. So I had to really understand, okay, here's the symptoms. I see it coming. Let me
Yeah.
get ahead of this. And I would take him to the doctor. If I didn't take him and my daughter took him, I'm like, you tell her this is what I want. Because
Yeah.
I knew that if he got this particular medicine, then in about 3 days, he was going to be okay. He's
Yeah.
going to turn that corner. We're going to give him a breathing treatment. He's going back to school. But this particular time, there was a new doctor. And she was like, "Oh,
Oh
I
my
don't give,
gosh, I could
I don't give,
stand them new
yeah,
doctors.
I'm not, I don't give that, but I can give this." I said, "No, I want this because I know it helps him, regardless of what you think he needs. This is by experience. This is what he needs, and I need a good. I was always asked for five dosages, and she was like, "No, I'm going to give you 3 days." I said, "No, I need 5 days." 3 days was fine, but I needed the extra 2 days just to hold and keep on hand.
Mm-hmm. It's
But
the truth.
it's being able to stand up to these doctors when
Mm-hmm.
they try to imply this is what I give to all kiddos. And I'm like,
Yeah.
Grayson isn't all kiddos.
Not
He's
all
different.
kiddos.
He is not a one size fits all type kid. So this is what's going to work for him. Once she saw me keep coming, and she was like, "Is mom coming?" No, he has grandma, his advocate today. His advocate is here.
Now
He's
get that
coughing.
pad out and write them what I told
That's
you.
it.
Right.
He's
Yeah.
coughing. He's been coughing all night, and this is what I need.
Yeah.
So she had gotten to the point, and she'll start, giving me what I wanted, because you've gotta you. Sometimes these doctors they have to listen to us as
Mm-hmm.
caregivers, grandmas, moms, dads. They need to listen to us because we are the ones that are truly caring for these kids. We know what the sicknesses look like. They get to go home,
That's
so
right. And get some
being able
sleep.
to express that, yeah.
Yeah. I
Hmm.
know another thing that and I ain't gonna lie, Bunny. I thought that was just Morgan. I mean, I thank God it's gotten much better.
Yeah,
But
with Grace
when
the
I would take
same.
her to urgent care, they was like, "Mom, we can't keep putting her on the antibiotic." I said, "Well, what would you
That's
propose I
right.
do?"
This is
I
what's
mean,
going
I
to help.
don't
This is
know.
what they
You think
need.
I want her on the antibiotic? But
Right.
I can't let this go on because it's not going to stop. And when
And they're
Morgan,
miserable.
ever since Morgan was born, she had chronic ear infections.
And that's
Chronic.
painful.
Yes, chronic. So when you look in her, every time something happened and I give her medicine and it wouldn't clear up, I said, "This is an ear infection. Take her in." "Mom, it's an ear infection. Mom, we can't put on an antibiotic." "What do you want me to do?
Yeah,
Do
that's
you have another
crazy.
remedy? Do you
Right.
think I want to walk the floors all night?" This is a medical crisis because, first of all, it's for me because I can't, if I'm not getting no sleep, I can't
Right.
properly take care of her, you know. And I will say, I think that's something that is very important that most people don't think about is your family medical history.
Absolutely.
That
Yep.
is
Yep.
so, because
Yeah.
something that, and I know we get ready to wrap this up, but I
Yeah.
really enjoyed
Yes.
this
Yes.
subject. Um, something that really when you have a kid, you have a mother's side and you have a father's side. So a lot of those things, when you trace them back, they something it's something in that family line that it points to why this is, like, not talking about the special needs
Yeah.
individual, but
Yeah.
I'm just talking about something, that a trait that came up, because even with Morgan's the platelet condition. They was like, well, where did this come from? I mean, and I was curious to know too. I was on the talking to her dad about it because
Hmm.
his mom had some type of blood condition that she died from. So
Oh
we were like
wow.
trying to figure out if it was associated with that. I mean,
Hmm.
so a lot of the times knowing that family history is so important. And I
Yep.
know my best friend's mom used to always talk about you got to be careful when you just get with people because like in our community with sickle cell, a lot of people don't even know they're carriers. So
Right. Yep.
and like I say, with Morgan having thrombocytis, I don't know. It doesn't look like it come from either side, but sometimes it's in the bloodline.
Hmm.
And so you gotta make sure that you are well aware of that family's bloodline because when you produce that child, it's chromosomes coming from each side, mother and father.
Wow.
So you gotta really be careful. You can't, and I know some people when you have a child, they might be like, well, they don't see the father, they don't be bothered with the father, or vice versa with the mother. But you got to understand that that side of the family, those chromosomes are still in that
That's
child.
right.
And in some sicknesses skip generations.
Yeah.
So you
Yep.
have to
Yep.
understand that family history. So
Yeah.
that's kind of my closeout. I know I wanted to say that. It's just like something
Yeah.
always keep popping in my mind. Like this family, that medical crisis can come from lack of knowledge as it
Yep.
relates to your child's condition, the family, everything. So it's
Yeah.
I hope you've learned something from this because
This
I
has
mean
been
now,
great.
yeah, it's a lot of things that have come to mind as a result of this topic.
Yeah, I the only thing I want to add is we all should be CPR certified.
Oh, yes. Yes.
That's a very good training to get.
Yes.
I need to be recertified.
Me too, Bunny.
Yep, but
That
this
is
has
so
been great.
important. Yes, I ain't even there, but you know what that is definitely. I'm glad you said that because that's something I need to work on. And not saying that I would be the one to do it because I have to learn how to be calm. Yeah.
Yeah. Brian, you gotta stay calm.
Yeah,
You
because
gotta stay
Jeremy will be,
calm.
I'm not even gonna lie. Jeremy and hubby is probably the ones that would calm me down. So I think Jeremy is very calm.
Yeah.
So and he's been like that since he's been young. So I definitely hope that something we've said to you guys has really spoke to being dealing with medical crisis and dealing with sometimes things before they even become a crisis because I
Yep.
know for me some things that's a crisis when I look back I could have prevented something, some things you
Mhm.
can't. But for me, I think knowledge is power, and we don't have on our shirt that says that, but knowledge is
Yep.
power. When you know your individual, deal with them based on your knowledge of them.
Yep. This has been great.
Yes, it has.
I'm
Thank
gonna
you.
pack a bag.
Me too, Bunny. I'm gonna have a bag pack. I may pack one for me and hubby too.
Yep. Yep. You just never know.
Yes, well, thank you everybody for joining us. We will see you back again next Thursday. We hope everybody enjoys their weekend. And Bunny, thanks for joining me tonight.
Absolutely. Have a good one.
Bye.